Hi, my name is Chelsea Hope,
And my name is Samar Rashad.
and we're both residents here at NYU Langone, Brooklyn.
So, a little bit about our Brooklyn site. We have a few full-time faculty members and a few part-time faculty members. Our senior associate director is Dr. Adia, who we work with on a weekly basis. And our associate directors, Dr. Julie and Dr. Kaur, are working with us in the trenches in the clinic. And we have a handful of faculty members that work with us in the operating rooms during our sedations. And then we also have a in-house orthodontist who works with us for most of our orthodontic cases.
This is Aisha Liverpool. She's our program coordinator for all of the sites across the country. Most of you have probably heard from her. She likes to keep in touch and keeps you up to date on anything requirement-wise and transitioning into residency. So that's her contact information and her email below.
So once again, we're located in Brooklyn, New York. Some interesting facts about Brooklyn is that we would be the fourth largest city if we were not a part of the New York City, and we are larger than Manhattan. We have 30 miles of shoreline. We have over 700 art and cultural institutions. And one of our staples is Prospect Park, which is a large 500-acre park that was designed by the same individuals who had designed Central Park. And we also are famous for our Brooklyn Bridge Park, which is about 85 acres and extends about 1.3 miles alongside the shore. Brooklyn's also very famous for its celebrities. A few of the celebrities that have come from Brooklyn include Michael Jordan, Spike Lee, Al Capone, Adam Sandler, and a long list of other celebrities who actually currently live in Brooklyn. And Brooklyn has a median age of around 33, so it's a more young, hip crowd with always lots of things to do.
So a little bit about our clinic site. We're located in Sunset Park, and it's kind of in the nook of Brooklyn right there, as you can see in the purple circle. Our hospital is one of the federally qualified health centers, and it's a level 1 trauma center. We have multiple medical and dental locations throughout Brooklyn, and even though we are a dental program, we also have access to family medicine, OBGYN, pediatric, and many other specialties just within our hospital. Our mission at NYU Langone is to serve, to teach, and to discover daily through our integrated academic culture devoted to excellence in patient care, education, and research.
We have a relatively large multi-chair and discipline facility. We have a total of 14 dental chairs at our main site and additional dental chairs at our satellite clinics, which we will go over in the next few slides. We have a total of 10 pediatric dental residents, and we have once again, a large discipline facility where we collaborate with endo, dental anesthesia, orthodontic, and GPR residents, as well as an oral surgery and perio faculty members. So once again, Brooklyn here, we have a large sense of interdisciplinary learning, and it's great that we have other residencies within our clinic so that we can go to them for consults and kind of share experiences with them.
So about our clinic specifically, all of our dental bays or chairs are nitrous equipped, and you commonly will have an assistant, so you will get to experience four-handed dentistry. Our patient population is very, very diverse, and I can talk to you guys a little bit more about what that includes, especially at our off-sites. We also have access to take panoramic x-rays, Cephs, and 3D cone beams.
Our clinic hours are pretty nicely split amongst clinic experiences and also didactic experiences. So we are very heavy on the clinical aspect of the pediatric dentistry side. Monday and Tuesdays, we have clinic from 1 to 8 p.m. Wednesdays we're full day from 8:30 to 5, along with Thursdays. And Fridays we are 8:30 to 4:30. We do have Saturday clinics. Those run from 9 a.m. to 12 p.m., and those are every other Saturday. And during those clinics, we have 3 PGY1 residents and 1 PGY2 resident. Our evening clinics are on Monday and Tuesday, and those go from 5 to 8 p.m. That's where all of our first-year residents get additional clinical experience, and we have a PGY2 resident also available to help out in the clinic. The call schedule is Thursday to Thursday for 1 week, and how it works is we have a first year that is the first call, and we have the second year that is the second call. And for our on-calls, we get plenty of experience with trauma, with swelling, with lacerations, and we also get additional experience with oral surgery and the plastics department.
So we have a number of offsite locations, and they're all accessible by train from our main site. So there's definitely time included for you to travel to these offsite clinics. Some of the sites include our 7th Avenue Health Center, which is mostly an Asian population. Both Park Slope and Park Ridge, which usually it's mostly Hispanic, and then the Flatbush Community Health Center, which is mostly African American.
We also get a great deal of experience with ortho. We get about 1 to 2 days per month where we get to work hand in hand with the ortho residents here at the Brooklyn site, along with the faculty members. And we do everything from interceptive ortho, phase 1 ortho, to comprehensive ortho care for our patients.
So our in-clinic sedations, I think something that's very unique about our program is that we have the ability to do IV cases and oral conscious sedation. Sedation occurs usually 1 to 2 times a week, and we can do up to 2 to 6 cases per day. There's usually a few residents on the sedation days working up the cases and taking care of patients, and you have the ability to help either be an operator and or a monitor. When you're on sedation, you usually have your own assistant as well. And over the course of the 2 years in this program, you definitely will have more than over 50 sedation experiences by the time that you're done.
So for our in-clinic sedations, we do both oral and IV sedations. For our oral sedations, we do a 1 to 2 drug combination with nitrous oxide. And for our IV sedations, we have members from the dental anesthesia program here at the hospital come down and work hand in hand with us for these IV sedations. As a pediatric resident, not only are you the operator, you will also learn how to monitor. You will monitor the pulse oximeter, the blood pressure, the precordial stethoscope, the temperature, and the EKG throughout the cases.
And we also go to the operating room at least 2 times a week. Each day that we go to the OR, we have usually 3 cases, 3 patients a day. Most of our patients in this area are ASA 1 or ASA 2, and we work very closely with the medical and dental anesthesia teams because we have a dental anesthesia residency program here as well. We're the only hospital in the area that can provide endo care and oral surgery procedures in the OR. And along with sedation, you also will get over 50 plus cases during residency.
So we are very heavy on clinical experiences here at the Brooklyn site, but we also have time set aside for didactic learning. Mondays, 8:30 to 12, the first years will sit and learn with our associate director. They will review the guidelines, the handbooks, go over literature reviews, and present from textbooks that are required through the residency program. On Thursdays from 1 to 5, we offer the Pediatric Focus VTC lectures, which is a lecture that involves the other pediatric dental sites, Langone sites, and we are able to share experiences and learn together and ask questions. On Friday mornings from 8 to 9, we have orthodontic lectures at the ortho clinic right across the street, and we also have monthly meetings on Fridays as well. We Something interesting is we also have the opportunity to do literature reviews with the NYU College in the city. So once a month, first year residents are able to go into the city and meet with the NYU College pediatric dental residents and go over literature reviews with them. And it's an interesting experience. We take the ferry from the Brooklyn site to the city, and it's a nice way to kind of just wind down a little bit. We do have a research project that everyone's going to complete. We have asynchronous web-based modules and also 2 case presentations per year.
So some of our on-site rotations that we do, mentioned before that we do have a dental anesthesia residency program here, and so we all do an anesthesia rotation that is about 10 weeks. We learn how to intubate, place LMAs, help with airway management, and do airbag valve masking. Some of the other rotations that we go to, the other specialty departments include pediatric emergency and in-house medicine, and those are about like 4 to 5 weeks as well. And then the pediatric medicine and specialty rotations, some of them include nephrology, cardio, and gastroenterology. Some of our off-site rotations that we also participate in include craniofacial, the in-office sedation where we go into the city and observe at Dr. Siegelman's office, adult and pediatric sedations. And then like Dr. Rashad was mentioning, we also help with teaching and are very involved with literature reviews as well.
So a few additional offsite rotations that we have here at the Brooklyn site, including a teaching experience at the NYU College of Dentistry. And this is something that's completed during your second year. You will go there once a week, typically on a Friday, where you'll go ahead and mentor and also teach NYU dental students. We have a cleft lip and a palate rotation with Columbia. Columbia has a great craniofacial team, and as a second-year resident here at the Brooklyn site, you're able to work hand in hand with the team at Columbia and tackle complex cleft lip and palate cases.
Okay, and we also have time to do CE courses as well. We are very involved with the Greater New York Dental Meeting, which usually happens in the fall. It's one of I think it is the largest CE event across the world. And we also go to AAPD sponsored CE courses. There's a sedation course usually that occurs in August that we get the opportunity to go to as well. And also attend the board review course in the spring. As a second year, we get to go to the annual meeting with AAPD, and there's also the advocacy conference that happens in this spring that is usually in Washington, D.C. that we get to partake in as well.
So we are a fun group here in Brooklyn. We like to go out. We like to enjoy ourselves. We live in New York, some place that many people aspire to live in. So we go out for drinks. We go out for food, either as co-residents or with some of our faculty members. And we like to wind down, especially at the end of the week.
And these are just some more pictures of us hanging out, and you can see on the top right, that's where we take the ferry to go to our literature review, and just some other pictures of us eating food. That's what we like to do in our spare time, and just some community service that we also partake in as well. Thank you.
Thank you.